Oxfam says as many as 12,000 people could die per day by the end of the year as a result of hunger linked to COVID-19. In a report published today, the organization reveals how 121 million more people could be pushed to the brink of starvation as a result of the social and economic fallout from the pandemic. Major areas of concern include mass unemployment, disruption to food production, and supplies and declining aid. We're joined by Mthandazo Ndlovu, who is Oxfam's Democracy and Governance Program Manager. Mthandazo, good evening and thank you for your time on News at Prime today. Firstly, how dire is the situation that we're dealing with here when it comes to the hunger levels?
Thanks, Cathy, for having us. The situation is quite very dire, as you correctly point it. If things don't change, we're saying close to around 12,000 people could die on a daily basis. Of course, this is a combination of a number of issues, such as, of course, the impacts of COVID-19. Now there is, of course, the issue of rising levels of inequality. And in some instances, it's as a direct outcome of crises such as conflict, but also the climate crisis is further exacerbating the situation. So, for instance, in South Africa, just before COVID-19, we had plus or minus 13.7 million people facing hunger on a day-to-day basis. Well, according even to government's own report that they published last year, through the presidents and the World Bank, they were saying 25% of the population, which could be about 14.2 million, was already unable to afford buying food. And of course, most of the people that are not able to afford live in rural areas. Of course, they are found in informal settlements, etc. So this is the crisis that the world is facing unless things change.
When it comes to the supply of things such as food parcels that people have been promised over the COVID-19 period, the 350 Rand of assistance that was going to be given to South Africans, do we know yet what the impact of that has been? Is it making a difference? Are we able to gauge yet?
Well, even according to Statistics SA's own numbers in terms of the upper poverty line, I think they put the figure at around 580 something Rand per month. So the 350 is completely insufficient to deal with household food insecurity, let alone other essentials such as, of course, meeting basic household needs such as water and sanitation. So it would be insufficient. Much more needs to be done structurally, also in terms of investing in agriculture, but also really ensuring that those who bear the burden of food insecurity, mostly women in rural areas and in townships, get the necessary support from the government. And of course, the much delayed land reform program further compounds our situation. The challenge in South Africa that we also face is the issue of cost of food is the one that further complicates the issue of hunger. Well, because now majority of the people are unemployed as a result of COVID-19 lockdown and massive retrenchments, that naturally would mean millions of people would fall into that line of being unable to provide for their families. So naturally, I think there should be mechanisms to regulate the food systems and the value chains.
What are the interventions that can be put in place to help us from getting to a situation where people are literally dying of hunger?
At this stage, there could be a number. Firstly, there has to be investment in agriculture. Of course, we know the levels of land inequality in South Africa. This is also the systemic contributor to why there is this food insecurity, but also social protection mechanism. The government should be able to at least increase the figure of the COVID-19 relief fund to a much higher figure as per the state SA interventions, and also through a global effort such as the UN call for financing for the COVID interventions through the World Food Programme, they must be pulling together of resources. For instance, one of the impacts as a direct outcome is the issue of closure of borders. As you know, majority of the people depend on remittances in the region of Southern Africa. So once there is that closure, there is direct disruption of food supplies and support to families.
All right.